Hi, I'm Megan Warner. If you were given the chance to save a life by performing CPR, cardiopulmonary resuscitation, would you know how to do it? Well, I plan to teach you the proper techniques to perform CPR on adults, infants, and children. Now, sudden cardiac arrest is the leading cause of death in adults, and nearly 75% of all cardiac arrests happen in a person's home. CPR doubles a person's chance of survival. Now, the information and instruction for performing CPR come from the American Heart Association, Mayo Clinic, and Washington University Medical School. So let's start with adult CPR. Before you start, check to see if the person is conscious. If the person seems unconscious, shake their shoulder and loudly ask, "Are you okay?" Now, of course, if there are two people available, one needs to call 911 immediately. If you are alone and have immediate access to a phone, first dial 911 unless the person is unresponsive due to drowning. Now, an easy way to remember which order to perform CPR is to remember the word CAB, C-A-B. CAB stands for circulation, airway, and breathing. And circulation is restored with chest compressions. Now let's begin. First, put the person on their back on a firm, flat surface. Then kneel next to the person's neck and shoulders. Place the heel of one hand in the center of the person's chest between the nipples and place your other hand on top of the first, keeping your elbows straight, and then try to position your shoulders directly above your hands. Use your upper body weight as you push down on the chest at least 2 inches 30 times. Push hard at a rate of about 100 compressions per minute. For example, 1, 2, 3, 4, 5, and so on until you get to 30. Now, if you haven't been trained in CPR, continue chest compressions until there are signs of movement or until emergency medical personnel can take over. If you have been trained, go on to check the airway and begin rescue breathing. Now, the next component of CPR is to clear the airway. When you have performed 30 chest compressions, open the person's airway by using the head tilt chin lift maneuver. Put your palm on the person's forehead and gently tilt the head back with the other hand. You want to gently lift the chin forward to open the airway. You want to check for normal breathing, but don't take more than 5 to 10 seconds. Look for chest movements and listen for normal breathing sounds. Also, you want to feel for the person's breath on your cheek and ear. Now, if the person isn't breathing normally, begin the mouth-to-mouth resuscitation. Now, the final step is breathing. Rescue breathing can be mouth-to-mouth or nose-to-mouth, depending on if the person's mouth is injured or if it cannot be opened. First, you want to pinch the nostrils shut and cover the person's mouth with yours, making a tight seal. Then prepare to give 2 breaths. The first breath should last about 1 second while you're watching to see if the chest is rising. If it does rise, give a second breath. If it doesn't, repeat the head tilt chin lift maneuver and give the second breath. 30 compressions followed by 2 breaths is considered 1 cycle. Just continue CPR until there are signs of movement or until emergency medical personnel can take over. Now let's move on to CPR for children. The procedures for giving CPR for a child ages 1 through 8 is basically the same as that of an adult. These are the only differences. If you're alone, perform 5 cycles of compressions and breaths before calling 911. Use only one hand to perform compressions rather than 2, and breathe more gently. Now let's move on to CPR for an infant. Most cardiac arrests in babies are from lack of oxygen, such as drowning or choking. Now, if you know that the baby is choking, then first perform first aid for choking. If you don't know why, then perform CPR. First, you want to examine the situation. Stroke the baby and watch for a response, but do not shake the baby. Now, if there is no response, follow the CAB procedures and call for help. If you're alone, do 5 cycles of CPR before calling 911. Now let's begin with circulation. Place the baby on their back on a firm, flat surface such as this table. Then imagine a horizontal line between the baby's nipples. Place 2 fingers of one hand just below this line in the center of the chest. Gently compress the chest about 1.5 inches. While you're doing this, count aloud as you compress at a rate of about 100 compressions per minute. For example, 1, 2, 3, 4, 5, until you get to 30. Now you want to clear the airway. After 30 compressions, gently tilt the head back by lifting the chin with one hand and gently push the forehead back with the other. Taking no more than 10 seconds, put your ear near the baby's mouth and listen for breathing. Now let's move on to breathing. First, cover the baby's mouth and nose with your mouth. Prepare to give 2 breaths, using your cheeks to give gentle breaths of air. Take 1 second for the first breath and look for the chest to rise. If it does, give the second breath. If not, clear the airway again and give another breath. Now, if the baby's chest still doesn't rise, check the baby's mouth for foreign material. If you see something, sweep it out with your finger. Continue the cycle until you see signs of life or until medical personnel arrive. Again, remember the acronym CAB for the order of CPR: circulation, airway, and breathing. And just remember that even if you're not performing CPR perfectly, you can still double the chances of saving a person's life. Thanks for watching.